These are normal responses to an extraordinary event. So it's your brain processing the event. But the trauma the responses become a medical issue when symptoms are prolonged and they can't be managed.
Post-traumatic stress disorder can have a massive impact on somebody's life and, of course, their relationships. And the symptoms of post-traumatic stress disorder can feel really strange and can often make people feel like they've gone crazy. It's quite a normal reaction when you've had horrible things that you've seen in your life. It's a normal reaction to have some of these symptoms of that might be manifest. So they're normal reactions to an abnormal event, and it can be treated effectively.
So the impact of trauma on everyday life might be problems in regulating our feelings and actions, which can lead to extreme emotional highs and lows, which can be so uncomfortable. Might be difficulties processing sensory experiences and regulating the body.
So that's not being able to kind of really understand things or hearing things, not being able to hear really what people are saying, feeling quite confused or looking at something and not quite understanding what it is. Sorry.
There might be difficulties in memory, or you might have memory gaps, which can be really frightening in themselves, and in making sense of things. And trusting others can feel frightening. So going on to make stable, caring, intimate relationships can feel really hard to tolerate. And these can all be just these are the impacts of this experience. And again, these are normal responses to an abnormal situation.
I'm just going to go through the very simple things that happen in your brain. And just to reiterate, I think it's really important to understand, because it's something about trying to gain some sense of control over a situation or what happens to oneself. So understanding it just gives a little bit of insight into ourselves and what might happen to us. The good news is our brain has an amazing capacity to regenerate. So if things happen to it, we can regenerate it and make things better to a certain extent. There's two parts of the brain that are relevant for this. I mean, the whole of our brain is relevant, but the amygdala is the part of the brain, when I was talking about the animal instinct, that's the part of the brain where the animal instinctive survival related, what's called survival related threat identification. That's where our triggers for flight, fight, freeze and flop come in. And it links, this part of our brain links memories with feelings, with our emotions. And it's the non-verbal part of our brain. So after a trauma, the amygdala can get very much caught up into something that's high alert, which is what it does. It's its job. That's what its job is to do. It gets caught into high alert, but it can stay in an activated loop. So it stays in this position where it thinks that it's still in threat. And it, as we described before, that's very normal after a traumatic event for everybody to experience afterwards for a while. You just, your brain takes time to kind of regulate itself back normally. So it stays in this activated loop where it looks for perceived threats everywhere, and that's called hypervigilance. So you're looking around constantly. Do you think something's going to happen? Are you sure? Could this happen again? You feel in this state. And just to remind you, post-traumatic stress, when it's stuck in that part of the brain for a very prolonged period of time, that's when it becomes PTSD. And what the treatment is trying to get it from the amygdala part of the brain into the hippocampus part of the brain, which is the cognitive talking part of the brain. And there's treatments that do that. The treatments, which I can't remember if we mentioned them or not, but there's a number of different ones. Part of them is cognitive behavioural therapy, trauma-informed cognitive behavioural therapy, or EMDR, some of you might have heard of, which is eye movement desensitization and reprocessing. But it can rewire your brain. It's possible to rewire your brain so that the repeated loops or the feeling under threat goes. what happens when your brain is in this situation, and I can't say this word, is the stress hormone. How do you say it, Bobby?
I think it's glucocorticoid.
Okay,
so I might be wrong.
So if anybody knows how to pronounce it, please do tell us. Anyway, this hormone kills cells in the hippocampus, which is the cognitive thinking part of the brain. And it makes it less effective when this happens to make what they call synaptic connections, which means it makes it harder for us to consolidate memories. What that means is it makes it harder for us to move on from those really difficult experiences. The hormones that I've been talking about also keep the body and mind stimulated in a reactive mode. So you're still hypervigilant reactive mode. It's a message that the threat has gone into the past tense, hasn't been able to get through to the thinking part of the brain. And the constant high stress messes with our hormones, where it messes with our body's ability to regulate itself. So you're in this kind of high stress situation, and it's difficult to kind of get to a place where you feel calmer. And if it stays on this high alert, the nervous system, and remains highly activated, it can lead to difficulties within the body. You can be exhausted in a number of different ways and get the physical symptoms that we were talking about possibly earlier. And your adrenal function, your adrenaline levels are really high. What that means is very simply that your heart rate and your blood pressure might be up, which we know is not good. It also shows the interrelationship with the physical and the psychological. But the good news is there are also things we can do to calm ourselves down and to begin to regulate ourselves. The treatment of PTSD depends on the severity of symptoms and how soon they occur after the traumatic event that we're talking about. Any of the following treatments may be recommended if you know, through the NHS. The first predominant one is what they suggest is watchful waiting. So that is to monitor your symptoms and see whether they improve or get worse without treatment. There's a trajectory of when they think post-traumatic stress disorder is. And they say after you can't, after a traumatic event, immediately after a traumatic event, you can't have treatment for trauma necessarily, because as we described, it's normal to have these symptoms. It's if they're prolonged and go on for a long period of time, and how long that is and how much it impacts on your mind, on your life, might be something that they'll be wanting to explore. Part of the treatment might be antidepressants or psychological therapies, which is trauma-informed, what they call cognitive behavioral therapy. And that cognitive just means thinking, and behavior is about thinking, it's about changing the thought behavior you have in your head. That's what cognitive behavioral therapy is. Or the other thing is eye movement desensitization and reprocessing. So it's a way that you, it's a way of distracting your brain. A lot of these techniques about distracting your brain to a certain extent, or being able to help the bit that's stuck in the amygdala get over to the hippocampus. And there's a number of different ways that they do that, techniques. It's also important to know that you refer yourself or anybody that you know to psychological therapies. I mean, we know about waiting lists, etc., but it's important to know that you can self-refer, or you can suggest to somebody else that they can self-refer to the NHS, to psychological therapies, if they feel they need to.
The window of tolerance is a really important aspect of this work. It's the optimal window in which a person can function most effectively. And a traumatic event can cause a person to move outside their window of tolerance, and they may then feel unsafe. And I think part of our work and part of what we want to talk about now is sort of helping people to stay within what we call the window of tolerance. keeping within this zone can be supported by a number of things, which you probably, a lot of you already draw on to help yourselves and to help others. So keeping within this zone might be supported by mindfulness techniques. I don't know any, maybe we can talk about this in a little while. Breathing, grounding techniques, and just orientation in the space that we're in. So when we started at the beginning with I held my orange and you know, spoke about the smell, which brings me comfort. It's really helpful to orientate in a space just to ground ourselves with things around us that can really help. So the following can help us feel more grounded. Doing something that brings ourselves or someone else into the here and now. So that again is a smell can be really helpful in just bringing somebody back into the present. Distraction, doing something active. So we use these techniques a lot when we work with young men in Calais. So it might be literally diverting somebody into a different activity than the thing that they're involved with, just to distract them into something else. Or going outside and kicking a football. And activating multi-sensory capacities, taste, touch, sound, sight, and smell. These all help us feel grounded. Grounding techniques, breathing, just is so, without breathing.
It sounds so obvious. I know it sounds ridiculous, but it's so important. I mean, you know, mothers, group of mothers here, when you're giving birth, you don't have an epidural, you know, the whole idea of kind of breathing through the pain when you're in labour. I mean, we know how important and significant breathing is.
A tactile activity, holding an object in the palm of the hand and focusing on it. We've already talked about that. And then directed sensory activity, rolling clay, folding paper, molding plasticine, and muscle relaxing movement.
When you're feeling really stressed, I don't know if you've ever done this, you know, one of the things to do is if you squeeze your fists really, really, really tightly, like that, and then you let go. So you squeeze something really tightly and you let it go, and you squeeze it really tightly. That can help kind of alleviate very overwhelming feelings as well. And as Bobby said before, things like running on the spot as well. We
in our work talk a lot about protective factors. And these are conditions that help individuals, families, communities to minimize the impact of traumatic events. And they can increase a sense of well-being, and they can help the individual bounce back. So they can buffer risks and stress. Resilience is increased where there is the presence of protective factors. So what are these? And these are things that all of you will be familiar with, and they're just so important to all of our lives. The availability of societal, peer, or familial support. The ability to discuss the events with parents or other supportive figures. And as Miriam said, the support group that you're part of is just so pivotal as a protective factor. Involvement in church, in mosque, in school, in community groups. Strengthening of coping strategies in response to stress can lead to increased resilience. Love, family, friends, health, spirituality, work, creativity. So as Miriam says, one of these might be more significant. For example, spirituality might be the thing that really is sustaining and keeps you going. Or it might be creativity. Staying socially close, even when remaining physically distant, has been so important for so many people. And we've really found that the importance of a daily routine has been important too, and is important in all our lives. And setting short-term goals, keeping active, and some people keeping active might be getting involved with some sort of sports or formal activity, but also just keeping active in daily life. And as Miriam said earlier, compassion can be difficult towards ourselves, but can be so important. So compassion towards self and others. It's an emotional response believed by many to be an essential aspect of well-being.